those common nutritional problems that you may experience living with sickle cell, or, if you are a parent or a carer of someone living with sickle cell, giving you the knowledge, the skills, and the tools to be able to help support them through these common nutritional problems they may experience. So the agenda for tonight is lighter, but there's still so much to share with you guys. So I hope you've got pen and paper handy to take lots of notes. So as usual, I start the session with a recap of the previous session. So just so that those people joining for the first time can have a sense of what we've been talking about. And we've been carrying quite a number of themes and principles throughout the session. So again, it's just to recap that and to reinforce that and to refresh that knowledge as well. And then part two, it's still part of the recap, but this time it's focusing on the Sickle Cell Nutrition Eat Well Guide, which we've been doing every week, but just giving an overview and a new perspective or fresh perspective in the context of how it adds to the prevention and treatment of common nutritional problems. So do take note when I talk through that session, because it almost prefaces and prepares you for part three, which is then the main focus of this evening's session, the practical tips and strategies to manage some of those common nutritional problems, as I've mentioned. And as per usual, I like to end off with empowerment and lifestyle tips, because it's so important that we, leave on a positive note and that we leave with some idea of what we're going to do differently moving forward. So again, those who've been on all the sessions so far, you will know who I am, but this is just for the benefit of those people who may be joining for the first time, a little bit of background about me. So you can tell by the accent, I was born in South Africa. And the reason why that's significant is because I grew up under the apartheid regime, and so experienced firsthand racism, marginalization, disempowerment. But that has been really, the mainstay of the work that I'm able to do and fight the fight in promoting and advancing sickle cell nutrition. So yeah, through my social justice advocacy and empowerment work, because of that experience, I am passionate about making the change in improving the access and outcomes of patients to nutrition. So I moved to the UK in 2000, and I was introduced to sickle cell in 2011. And I worked in a sickle service from 2012 to 2016. But 2014 is important because that's the year that I actually was made aware of nutrition in sickle cell, because I'd never heard of that before. I spoke to a GP. Sorry, I spoke with a GP who has a special interest in sickle cell, about my ideas of what I wanted to do in sickle cell nutrition. And her advice to me in 2015 was, you need to do a doctorate. So I started my doctorate in 2016, self-funded, because no one was interested in supporting me, and completed it in 2023, the end of 23. And soon after started my non-profit organization called Sickle Cell Nutrition Academy. Many of you will have heard of that. And I now work as a consultant dietitian to advance sickle cell nutrition. So that's me. And that's the last time you'll hear that from me for this course. So moving on to part one, which is the recap of previous session. So again, as I've said before, I can't speak about sickle cell nutrition without this slide. This slide gives the foundation of where nutrition in sickle cell comes from, because there are still people who ask me, is nutrition in sickle cell a thing? And yes, it is a thing because of these three main clinical features in sickle cell disorder. And the first one is chronic hemolysis. So essentially that is the rapid breakdown of your red blood cells, which means you need to be making more red blood cells on an ongoing basis. But the consequence of that need to make new red blood cells and having less red blood cells is that many of you will suffer from chronic anemia and fatigue. And we spent a big part of last session looking at fatigue. As I said, you have this increased red cell turnover where you have to make more red blood cells on a really quick turnaround. There is extra pressure on the heart to pump the blood around the body. So you need more energy, and the heart needs more energy to be able to do that. There's also this thing called increased oxidative stress, which is an imbalance of harmful substances in the cells that can cause cell damage, and this leads to chronic inflammation. The next one is vaso-occlusion, and many of you will know it as sickle cell crisis. So this is the blockage of large and small blood vessels when the hemoglobin molecule under low oxygen levels changes shape and takes on that sickle shape, and that blocks these large and small blood vessels. And this ongoing process is what causes the tissue damage, the organ damage, and many of the complications that you experience living with sickle cell comes because of this process that happens in your body, that also leads to chronic inflammation. And then the third clinical feature is the impaired immunity, because many of you, your spleen is, in fact, the functioning of your spleen is impaired, and that increases your risk of infection. And when you have an increased risk of infection, that can increase your risk of malnutrition, because it means that you need more nutrients, more energy, more protein during that time. And so if you're not getting in enough during that risk period, then that can obviously add to your risk of malnutrition. So this slide is very important. If you're new to this, I hope you've made notes of, I hope the explanations have made sense, because this is the foundation of why sickle cell is, nutrition in sickle cell is a real thing. So as a consequence of those features and those nutritional problems that I've identified in the previous slide, you have these nutrient deficiencies. And the nutrient deficiencies are both within the macronutrients. So macro means large. So it's your nutrients such as carbohydrates, fats, and proteins, and also fluid. And we know that sickle cell patients have an increased fluid requirement, but also the micro meaning small, the micronutrients, and that refers to the vitamins and minerals. And there is in the literature a whole host of vitamin and mineral deficiencies that we find in sickle cell disorder. And some of those include zinc, selenium, vitamin D. That's why many of you, will already be having a daily vitamin D supplement. I hope you are. If you're not, then that's something I would highly recommend, and is also recommended by the Department of Health. And then key antioxidant vitamins, vitamin A, C, and E. Your B vitamins, in particular folic acid. Some of you will be taking folic acid as a supplement, but others will be getting in your folic acid through the diet. And again, session 3, we had a couple of slides giving you the examples of the foods where you can get really good, sources of your folic acid. Also iron, but specifically in the absence of iron overload. So if you have iron overload, obviously you need to reduce the amount of iron you're taking through your diet. And then also omega-3 fatty acids. So we'll speak a lot about that as well as the presentation progresses. So moving on. So we spoke also in last session about considering your nutritional goals. We know that you will have nutritional problems based on those clinical features that I mentioned a few slides ago. And so it's important for you to be able to recognize what are some of the nutritional goals, what are some of the nutritional problems that you're struggling with, and what are the goals you need to set around that. For some of you, it may be because you have a reduced appetite and you want to improve your appetite. For some of you, you may be a low weight and you want help and support with gaining weight. For some of you, you may need to lose weight. And particularly what the research is showing that patients with the SC hemoglobin genotype, they are prone to have a higher weight. So it may be that, if you're living with SC and you have a higher weight, you may want to lose some weight. It may be that you can't maintain your energy levels because you have, ongoing chronic anemia and fatigue, and you want support with maintaining energy levels. And we spoke a lot about that last time as well. It may be that you have chronic infections and you want to help, reduce your risk of infection, and we will be touching on that this evening. Some women living with sickle cell can have problems with menopause, and the risks associated with menopause is osteoporosis. You can have an increased risk of osteoporosis, and we'll touch on that later on. But also you can have an increased risk of cardiovascular disease, and we'll touch on that as well a little bit later on. But some of you living with sickle cell will have other long-term conditions that you're living with. Maybe that you have hypertension, high blood pressure. It may be that you have diabetes. It may be that you have, heart disease, and or some other conditions as well. And it's just sort of, how do you navigate your sickle cell, the complications, the nutritional implications, and still those other long-term conditions. So we touched on that last time. And then we also touched on sort of important lifestyle changes. And so lifestyle changes refers to activity levels. So being more active, not necessarily going to the gym because it's not for everybody, but just moving more, and we'll touch on that later on in the presentation as well. So if you are taking alcohol, again, being sure that you're taking alcohol within the healthy limits of 14 units per week for men and women. But I wanted to focus on smoking because smoking, particularly when you're living with sickle cell, is such a risk factor that I wanted to highlight the risks and the problems and the damage that smoking can cause when you're living with sickle cell. So it causes damage to the blood vessels, and we know already that with sickle cell, the crisis, the blockage of the large blood vessels, that can already have a host of problems. So imagine, because of smoking, now you're causing damage to your blood vessels. How much more damage can you cause to your body and to your overall health and well-being? Smoking can cause plaques to build up in your arteries. So again, narrowing how the space through which blood can flow, which we know already is a problem because of the sickling, the blockage of the small and large blood vessels. It can increase your blood pressure. So if you're already living with, high blood pressure and you're smoking, it's just making that so much more worse, and it can increase your heart rate. And so, you really, I can't stress enough, if you are smoking and you're living with sickle cell disorder, then please, 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 I beg you to consider stopping and speaking to the smoking cessation services at your GP practice. We also spoke about considering self-care, and we spoke about nutrition as almost an act of self-care, but also generally. So a healthy diet, we know, and that's been the foundation of all of the talks that we've been doing, and will continue to be. So a healthy diet is really important for self-care. Engaging in regular activity, I've already mentioned that is a really important part of self-care. But sleep, at the end of the presentation last time, people were saying that they need to look at their sleep routine and try and improve that. So having a good sleep routine is essential for self-care. Creating a good, relaxing sleeping environment, even more important as well, to help you if you're really struggling with falling asleep and getting to sleep. But having regular relaxation, what do you like to do? Do you like to read? Do you like to go for a walk? Do you like to go out with friends? Think about those things that you enjoy doing, as an act of self-care, and do it. Don't just think, but take action and do it, because all of that will help contribute towards improving and enhancing your self-care. And then for some people, they may need treatment, they may need support with being able to do that better. So cognitive behavioral therapy is available for patients. You may be able to speak to someone to, as I said, give you advice around sleeping. Some of you may need to have blood tests. But the point I'm trying to make, and I was making last time, is that self-care is important, but nutrition is definitely an act of self-care. And then this slide, how many of you remember this slide? And when I spoke about this slide, I mentioned that if we fail to plan, we plan to fail. Really important. This slide was all about the importance of planning for healthy eating, because it isn't easy. It's not easy. And that's why it's important that we actually take the time to plan our meals, to plan what we're going to do, how we're going to do it. You've been given a lot of information over the last session and certainly tonight as well. And it's using that information, using the information about what are my nutritional needs. We've just gone over the slide to think about what are your nutritional needs, what do you need more help with, and plan around that. How do you think you can do that better? And certainly the Eat Well Guide, and I said we will touch on that in the next part again. The Eat Well Guide is a really helpful tool that has been designed to enable you to be able to do that really well. And the 7 healthy guidance that's within the Eat Well Guide, again, will help to enhance the knowledge, the skills, that you can use to make this healthy choices. But the first 3 points, of the slide, and when I was speaking about it last time, actually comes from the 7 Habits of Highly Effective People. And that's a book written by a leadership guru called Stephen Covey. I really love Stephen Covey's work, and I love the 7 Habits of Highly Effective People. And I thought it fit really well in getting us thinking about what it is that we need to do to plan, for healthy eating. And so the first thing that he says, or one of the 7 habits he says, is first things first. So, and in the context of us and what we're speaking about in this course is the importance of prioritizing your health. You have to prioritize your health. If you don't, then there will be other things competing with that, and you won't be able to get the benefit, the full benefit of, all of the good choices and decisions that you make in terms of that. So definitely, first things first, prioritize your health. And then the second point there is begin with the end in mind. What is it that you want to achieve at the end of all of this really good choices, this planning, the fact that you've invested all this time listening as well. What do you want to achieve at the end of this? So identifying your health goals. And again, those health goals can be in relation to the health risks and needs that you've identified for yourself over the last sessions and maybe at the end of this as well. But begin with the end in mind. Where are you? What are you wanting to achieve? And then the third one is be proactive. Consider self-management options. Don't wait for other people to say, oh, have you thought? Take action, prioritize yourself and take action, be proactive, and put in place those strategies. Do you need to sleep more? Do you need to have more fruits and veg? Whatever that might be, but be proactive in taking action to put that in place to support you. Make wise decisions. It's so important that we use wisdom. And as I said before, you've got you've received so much helpful, useful information over the last couple of sessions, and certainly this 4th session as well. So use that information to make wise decisions and to choose healthy options. The next point is preparation and planning is key. As I said, if you fail to plan, you plan to fail. So you need to prepare, you need to plan, and you need to do your homework. And all I mean with homework is taking some time out to write down what it is that you want to do. Get some colorful post-it notes, stick it up around the house, share it, do it as a family. Decide as a family what it is that you want to work towards in terms of health, in terms of nutrition, in terms of meeting your health goals, and stick it up around the house and do it together. But you do need to do that preparation and that planning work. And then lastly, very important, don't do it alone. Ask for help. Ask your sickle cell nurse or your consultant or your GP, or your network, your social network, your family, your friends, to help you do this, because as I said, it's not easy. And so having the help and support of others is definitely important and will go a long way in you being able to achieve your health goals. So that's the recap of the session 3 that we spoke on. As I said, part 2 of this evening session is essentially a recap and reviewing the Sickle Cell Nutrition Eat Well Guide, but framing it in the context of prevention and treating the common nutritional problems that we'll be looking at in part 3. So yay, Sickle Cell Nutrition Eat Well Guide. I can't stop sharing it. And please, if you haven't downloaded this, then please do. I've got a student dietitian who's doing one of his placements with me, and he's actually conducting a survey to see how people are using the Sickle Cell Nutrition Eat Well Guide. So if you download it, please, do complete the survey. It will really give us helpful information as to how we can improve this, how you're using it, and give us helpful ideas as to what other nutritional resources, we can add to the nutrition compendium. But the benefit of the Eat Well Guide, as I said, is to give you the information, the guidance around the different food groups and the different foods under the food groups that you need to choose to help you make good decisions. And the added benefit of the Sickle Cell Eat Well Guide is in this next slide. It contains these 7 key healthy messages that gives you important information around some of those common nutritional problems that you may experience living with sickle cell disorder that we will be addressing in part 3 of this presentation. And so I'll just quickly, briefly run through that. But as I said, we'll be going in a bit more detail, giving you practical strategies and tips to be able to manage that better. So, including energy boosting foods, we spoke about that, increasing protein intake, regulating immunity by including antioxidant-rich foods, reducing inflammation, improving your bone health, preventing dehydration, and also choosing healthy options. And we will go into that in a lot more detail in part 3. And so this slide I also shared with you last time because I thought it was really helpful just to show you again. This table highlights the main food groups that I've just talked you through. That's found in the Sickle Cell Nutrition Eat Well Guide. What are the functions of those food groups? Daily servings, and also what is a serving, because it's really helpful for people to know what a serving is. If I just go through the first one, the bread, cereals, rice, pasta, potatoes. So essentially your carbohydrates. And so the function of this group of foods is to provide the body with energy and fiber and some other B vitamins as well. And the daily servings range depending on how much energy you need. If you need less energy because you want to lose weight, it will be the lower number, the 5. If you need more energy, which we'll be talking on a lot more in part 3, you'll need more, so the higher number towards the 14 servings. An example of a serving there is 1 slice of wholemeal bread, 1 egg-sized potato, 3 tablespoons of breakfast cereals, 2 heaped tablespoons of cooked pasta. And as I said, going through this just gives you a really quick at a glance sort of overview of the different foods in the food groups, the functions, and also what the servings, and also what a serving size looks like. So I've asked you this before, and I've kept asking you over the last 3 sessions, why is good nutrition important? And I'm including this again because this is important, and this is the information that I am drawing on when I'm providing you that practical and helpful tips in part 3. And it's important that you understand why it's important. So why is good nutrition important? Because we want to ensure that you get a good nutritional status, and we want to help you prevent yourself from becoming malnourished. And so a good nutritional status is all about eating a balanced diet. So you've got your Eat Well guide, you've got your food, your 5 food groups, but it's eating the right amounts of the foods from those 5 food groups, the right quality, the right quantity, also thinking about your cultural foods, your cultural preferences, and it's choosing the right variety. Because if you only eat 1 or 2 foods, then you're not going to get the mix of nutrients, macro and micronutrients, that your body needs to prevent you from becoming malnourished. So variety is key, and variety in terms of you meeting your body's individual needs. All right. And also so that you can enjoy a good quality of life and do the things that you want to do. And so eating a balanced diet is that important. And you will recognize this slide as well. And so this slide is all of what we've just spoken about and what we're speaking about over the last couple of weeks is to improve your nutritional status. Now, nutritional status, again, is the foundation for what we're working towards, what we're trying to achieve with this healthy, balanced diet. But it's also looking at some other measures. Yeah. So, in addition to the healthy, balanced diet, that's one, and that's an important aspect. But we also need to look at the anthropometry. So, the size, proportion, and body composition. So what does that look like? It looks like your weight. It's knowing what your weight is, knowing what your height is. If you don't know your weight and your height, please get it checked by, when you go for your next appointment, or if you go to your GP practice, get that so that we can work out, or you can work out your BMI. And we in session 1, I showed you how to do that. So BMI is just your weight over height squared, and height squared means it's your weight times itself. And why is the BMI important? Because it gives us information around whether you are a healthy weight or not. And that will also help us to determine whether you have lost weight from your baseline or not. If we don't know what your weight is, we won't be able to work out whether you've lost weight or whether you've gained weight. And again, the weight gain can be because you're holding onto fluid, something called fluid retention or edema. And so we do need to know what your baseline weight is, as well as height. There's other measures we can do, but it's important that when it comes to assessing your nutritional status, we will be looking at your weight, we'll be looking at your height, your BMI, weight loss, whether you've gained weight, but also inflammation. You've seen that first slide I talked you through, that chronic inflammation is a key part of, the clinical features and the problems associated with sickle cell disorder. But also thinking about, how does sickle cell affect you? What's the disease burden, in terms of how sickle cell affects you, the complications, etc. So there's a number of things in addition to the healthy, balanced diet that we look at when we're looking at assessing your nutritional status, but also improving your nutritional status. And that's why preventing malnutrition is that important. And again, simply put, malnutrition is about ensuring that you're eating enough of the right kinds of food, you're eating the right amounts of food, you're eating a good variety of nutrients of food to meet your body's needs. And if that doesn't happen, then there's this imbalance of the essential nutrients that you need for good health. And it's malnutrition essentially refers to that imbalance of the nutrients, but there are also other sickle cell related factors that can increase your risk of malnutrition. And we'll talk through some of those in the next session. Good. So hopefully that will have laid, again, just a little foundation for the next part of this evening's presentation, which is all about the strategies, practical tips and strategies to help you manage some of the common nutritional problems in living with sickle cell disorder. We're going at a good pace. We may finish early tonight. You never know. I might have, more to say, but we'll see how it goes. But so far, we're making good progress with time. So what are some of those common nutritional problems that I keep talking about that you may experience living with sickle cell? So malnutrition, definitely, I've been speaking about that throughout the session. So malnutrition is a common problem, a common risk for people. Anemia and fatigue. Again, many of you will experience anemia and fatigue, impaired immunity, chronic inflammation, dehydration and constipation. We know patients have an increased risk of increase in fluid requirement, and we know that dehydration is a risk factor for sickle cell crisis. So we definitely want to look at that. We're going to be looking at that in a bit more detail. How do we prevent you and manage if you do have constipation, which is a side effect of the pain analgesia that you use to treat your sickle cell crisis. If you have iron overload, living with sickle cell, we look at osteoporosis, increased risk of cardiovascular disease. There was a question about how do you lower your cholesterol, so we'll definitely be looking at that. And also I'll be speaking on mental health and nutrition, which isn't commonly spoken about, in sickle cell. And so there's a couple of slides to focus on that as well. So we'll start off with malnutrition, and many of these things obviously you will identify because we've spoken about it a lot. But this is just, to complete the conversation in the context of those factors that fits under this umbrella of malnutrition. So what are the causes? What are the key nutrients that can cause malnutrition? You will know this already because we've spoken about that a lot. Protein. So not taking enough protein, because we know that if you're living with sickle cell disorder, there's this high protein turnover associated with this chronic hemolysis that you can have. There's this increased need for energy because of, the fact that your body breaks down the red blood cells so quickly. Micronutrients, you can have less vitamins, less minerals, and we know that there's lots of nutrient deficiencies that we've already identified because of those clinical features we've mentioned. You can have a reduced appetite, and we spoke about that in detail in the last session. And the problem with the reduced appetite is what? You're not taking in enough food. And if you're not taking in enough food, what happens? You're not getting in the range, the variety, the amount of nutrients that you need to support good health. And if you've lost weight, it also means that you're not taking in enough. And all of those factors can increase your risk of becoming malnourished. So as dietitians, what do we do when we have a patient who presents with an increased risk of malnutrition or is malnourished? We offer a first line advice called food first advice. So we would look at what can we do with a normal diet, with food, to enhance, to increase the protein intake and also the energy intake. And so what we do is we encourage food fortification, so fortifying or enriching the foods and the drinks that you naturally have in your diet. We fortify that to increase the protein intake, as I've mentioned, to increase the energy intake. And there's a couple of slides that will show you how you can do that. To choose foods that have that more energy in it naturally. So just to say at this point, so we've been talking about healthy eating in the context of maintaining a healthy weight. Some patients who are at risk of malnutrition, who are already malnourished, will need more. Remember the slide I talked you through in terms of the serving sizes for the carbohydrate foods. The range was between 5 and 14. And so when you have malnutrition or when you're at risk of malnutrition, then you need more towards the 14. And so this is what we're trying to achieve with food fortification or enriching the foods, is we're trying to ensure that you're getting in more energy, more protein. And another way that you can do that as well, particularly for those patients who are at risk of malnutrition with a small appetite, is to encourage you to eat little and often. Because many a times when you don't have a good appetite or you have a reduced appetite, just the sight of food can put you off eating. And so what we encourage you to do during that time is to eat little and often. So to have 5 or 6 smaller meals, or if you have your main meals, have snacks in between. In that way, you can ensure that you get a steady supply of energy, of protein, of vitamins and minerals in your diet. So when we've tried the food first advice, the food fortification or enrichment, and that hasn't changed your weight, or it hasn't achieved the goal that we want, to reducing your malnutrition risk, or you're still losing weight, then you can also have what we call oral nutritional supplements, which is prescribable. But to do that and to be eligible for that, you actually have to have a nutritional assessment from a dietitian. You have to go to the GP to be prescribed, and so so that's the next step, so to speak, almost, to help you ensure that you actually get and meet the energy and the protein requirements that you need. There are over-the-counter options that, if you are struggling, in terms of enriching your meals or taking in enough, there are, if you go to the bigger supermarkets or to Boots, you can buy Complan, you can buy build-up soups or shakes, and you can add that in addition to the food. It's always in addition to the food. Supplements are never a replacement. You know how you sometimes take meal replacements if you're trying to lose weight? This is not that. This is we adding to, we building on top of what you're taking in through your diet. And so the over-the-counter options will be exactly the same as the prescribable. It will be in addition to what you're eating. And how this presents, it can be in the form of sachets that you have to make up with full fat milk. And sometimes, not sometimes, the other alternatives are that they come as ready prepared drinks. Some of you may have had this if you've been in hospital and you've not been able to eat well, or you were, you had a must screening, and you were deemed to be at risk of malnutrition. You may have had this in hospital, the little energy drinks. So this is what I'm talking about. And there's a variety of them. There's the milk-based shakes. There is juice-based, there's some savories, there's some yogurt-based. So there's a variety of this. But as I said, any one that is prescribable, you will need a formal nutritional assessment to be eligible for that. So the next slide is just to give you again some visual, ideas and pictures and images of what that might look like. So if you're having soup, you can enrich and fortify your soup. You can stir in some cream. As you can see there, if you're having cereal or porridge, you can add in some cream. You can add in extra honey. You can add extra sugar. You can stir in some jam. All of those will help to add extra energy in terms of carbohydrates, in terms of fats. And this is what this slide is just giving you an example of. The next slide is ideas of how you can increase your energy and protein intake through protein-rich foods. And you can see there's eggs. So you can have eggs, you can have scrambled egg, that you make up with full fat milk. I love, having scrambled egg with milk. You can have cheese, you can have grated cheese on, your vegetables. You can have grated cheese, a sandwich, like in the example there, a nice, quite a lot, so using a lot more cheese than you would normally have. You can have nourishing drinks where you're using enriched milk. And enriched milk essentially is just taking a pint of full fat milk and adding 4 heaped tablespoons of dried milk. So, and a brand name that I can think of is Marvel. Some of you may have heard of Marvel, but some of the supermarkets may have their own brand of dried skimmed milk. And it's a dried skimmed milk powder that you can stir into drinks to add and bulk up the protein intake as well. So this slide here, again, is just to show you examples of how you can fortify and enrich some foods. So if we look at the first example there, the porridge with whole milk. So if you look at that, porridge with whole milk will give you 380 calories and 15 grams of protein. But you can increase that to 630 calories and 21 grams of protein simply by adding 1 heaped tablespoon of dried milk powder, 1.5 tablespoons of double cream, and a small handful of dried fruit. So by making small adjustments to that, can you see how significantly more you can increase your calories or your energy and also your protein intake? Looking at the second example there, the scrambled egg with whole milk. So just as is, will give you 210 calories, 16 grams of protein. But how can you take that up to 440, so nearly double, more than double, and 23 grams of protein? You can add in cubes of butter. You can add in a heaped teaspoon of the dried milk powder that I've mentioned, and also 2 tablespoons of cream cheese. So by making those simple additions, you can double the calories and also the protein intake. Soup. So many of you will have soup, when you're feeling unwell or when you have a reduced intake. How can you take that 190 calorie soup and 9 grams of protein to 400 calories and 14 grams of protein? Simples. 1.5 tablespoons of double cream, 1 heaped tablespoon of dried milk powder, thick spread of butter on bread. By just doing those simple things, you can increase the calorie and the protein intake. If you look at the shepherd's pie, the same thing. Instead of 420 calories, you can take that up to nearly 700 calories by adding extra butter, 1.5 tablespoons of double cream, 1 tablespoon of dried milk powder. And as I said, this is just simple examples of what you can do with some of the foods that you already have at home to increase the calorie, increase the protein content, to prevent and improve if you are malnourished, to improve that if you're at risk of malnutrition, to prevent you from becoming malnourished. Moving on. So don't forget, I know there'll be people thinking, but what about me? I don't drink milk. I'm lactose intolerant. And so I've included this slide to give some options for if you're vegan or vegetarian. And it's a similar principle. But instead of using milk, you'll be using milk alternatives. So I'll talk you through. So adding calcium milk alternatives like coconut, rice, oat, soya milk instead of your normal cow's milk. Using vegan protein powder such as Yule, adding extra protein scoops to other drinks, using milk alternatives when making hot drinks like hot chocolate, malt drinks, etc. If you've got, making instant soup, you can add your milk alternatives, add your milk powder, your protein powder to that to bump up the protein content. You can make smoothies with peanut butter or nut butters, adding some fruit like bananas, chia seeds, or your milk alternatives. Use vegan cheese, vegan cream that you can grate and add into food, or use vegan mayonnaise or salad cream in your sandwiches. So this is a way that even though you're following a vegan and vegetarian diet, you can still bump up, you can still increase the calorie as well as the protein intake in your diet. Right. Stuck. So even if you're following traditional cultural foods, thinking about what can you do, how can I do that? You can do that simply by increasing your portion sizes. So last time in session 3, I spoke about, because we were thinking about a healthy weight. So thinking about having a smaller portion. If you need more energy, if you need more protein, if you're following, a traditional diet, then just increase your portion size of the foods, have more of the snacks, because remember, our aim here is to increase the energy and is to increase the protein. It's not in terms of weight loss, and achieving a healthy weight. Here we're trying to get extra in to reduce and prevent your risk of malnutrition. Hopefully you found that helpful. It's given you some helpful tips as to what you can do to manage and better manage your risk of malnutrition. So now we'll move on to chronic anemia, which many of you, all of you, will experience because of this chronic hemolysis, ongoing breakdown of your red blood cells. And so many of you will have experienced tiredness. As you're listening, you may be exhausted as you're sitting listening. You'll experience weakness, you'll experience low energy. And as I've mentioned before, what we're trying to do here is we're going to be using, and I'm going to be referring to a lot of the principles that I've just spoken or shared with you in terms of the malnutrition advice, the food fortification, the food enrichment. So a lot of that I'll be referring to as we go through the next couple of slides. So I mentioned to you as well, if you've got a small appetite, but certainly if you start struggling with chronic anemia, then the advice is to eat often so you've got that regular supply of energy as you go through the day to counter the effect and prevent your energy levels from dipping through the day. So eat little and often. Choosing energy dense foods, choosing food fortification. And as I said, I've just talked you through simple, practical ways that you can add, that you can enrich and fortify your normal diet with foods and food stuff that you regularly have at home. Or if you don't have those foods that I've mentioned, maybe you can buy some in and have them in the house so that when you are, when you need it, you can just take it out and you can add and you can make those adjustments to your intake. And also thinking about good sources of iron. Iron-rich foods, certainly in the context of iron overloading, to reduce that, because as I said, if you are iron overloaded, we want to reduce the amount of iron that you take in through your diet. Um, Folic acid rich foods, because we know again, with this chronic anemia, because of the chronic hemolysis, this ongoing breakdown of your red blood cells, you need the folic acid to help make more, and the iron to make more red blood cells. So you want to ensure that you're getting in green leafy veg, broccoli, avocado, citrus fruits, whole wheat. So there's and that basically there's a range of foods there, and that speaks to the variety. That's why the variety of foods in your diet is so important, because you can see there's a range of foods there that you can get folic acid from. And so if you only eat from one food group, then you are missing out and you're limiting the range of nutrients that you need to take in to ensure good health. And then if you are suffering from chronic anemia and fatigue, the suggestion is to engage in regular, gentle activity, movement, exercise, not necessarily the gym, just regular movement, because that will also help to help you to better manage the weakness and the tiredness that you may experience. So hemoglobin, what is hemoglobin? Hemoglobin is a protein, and it's the oxygen carrying protein in the blood. And many of you or many patients I've spoken to have asked, how can we ensure that we have, good amounts of hemoglobin in our blood? And essentially, what we want to do is you want to reduce this ongoing sickling as well. But you also want to ensure that through the diet, you're taking in the right nutrients that's going to help you build the red blood cells that's needed for the hemoglobin, for the oxygen to be, to be perfusing the tissues and the cells. So what are some of those important dietary considerations and choices that you need to make? Again, balanced diet. So balanced diet refers to ensuring that you're getting food from all of the 5 food groups from the Eat Well guide. So your fruits and your vegetables, your whole grains, your lean protein sources, healthy fats, your dairy products that I've mentioned as well. So making sure that you're getting in that good variety of foods, taking in iron-rich foods. So red meat, we know, is the better source of iron, because contains the heme iron that's got a better bioavailability. But we also know, if some people are vegetarians or vegans, so it's ensure that you get a good amount of your plant-based protein foods as well, that can ensure that you're still getting in a good amount of iron. So foods like including dark leafy greens, your kales, your spinach, lentils, beans, chickpeas, fortified cereals. So when you're buying cereals, make sure that the cereal is enriched with iron. So that would be a better choice for you. And also tofu. So folate, again, we know we need folate to be able to make new red blood cells. So choosing the green leafy veg, again, citrus fruits, legumes, avocado, fortified grains. So again, if you're choosing either cereals or flours or bread, make sure that it's been fortified with folic acid. To get that extra folic acid in that way as well. And then other important nutrients that you need to consider to try and build up and maintain really good levels of hemoglobin is vitamin B12, and that you get from fish, poultry, dairy. If you are following a vegan diet, then the recommendation is that you do need to take a B12 supplement, because you may not be able to get it through because you're not taking in things like poultry, fish, and dairy. Make sure that you're taking in vitamin C rich foods, because vitamin C helps to absorb iron. Yeah, so it enhances iron absorption. So your citrus fruits, melons, peppers, strawberries, berries, etc. All of those foods are helpful in terms of absorbing iron, and that will also go a long way in terms of maintaining good hemoglobin levels. Limiting your intake of processed foods, so reduce your intake of high fat, sugar, high salt, sugar, and fat foods. Again, if you're thinking about the Eat Well guide, on the outside of the Eat Well guide, you will see there's examples of foods that you should be taking less in through the diet. So it's not that you can't have them, but you need to take in less of those. So definitely trying to reduce the intake of that if that is what you have quite often in your diet. And also staying hydrated. Hydration is important. We know dehydration is a trigger for sickle cell crisis. So we want to reduce and limit the onset and the frequency of having a crisis. So hydration in the context of hemoglobin and, ensuring that you have good levels of hemoglobin, hydration is really important. Remember, this is a process. Yeah, if you do have and as living with sickle cell, you will have you'll have your own baseline. Again, I always ask patients, do you know what's your baseline hemoglobin level? If you don't, please find out what's your baseline hemoglobin levels, because many patients don't know. It's important for you to know what your baseline hemoglobin levels are. And if you haven't been following a healthy, balanced diet up until now, and you're starting to do that now, remember, this will take time for you to benefit from the effects of this, but it is something that you will need to do every day. All right. So I just wanted to add that in. So that is looking at chronic anemia, looking at what you can do, practical tips, strategies to ensure good and maintain good hemoglobin levels. Now we'll move on to number 3, which is impaired immunity, because we know that if living with sickle cell, you have an increased risk of infection. And if you have an increased risk of infection, that can increase your risk of malnutrition. We've already gone through that in a lot of detail. And that means that it can increase your protein and energy, your need for protein and energy-rich foods. We spent quite a lot of time on that, so I'm not going to go into more detail. But also important in terms of food hygiene, so making sure that you're washing your foods, checking expiry dates, wash your hands as well if you've been outside and coming in, because obviously we want to reduce the risk of contamination, but also for you to, to take in bacteria through, through the food. So ensure that you follow good food hygiene principles. Impaired immunity, there's there's nutrients that can help address that, help improve and strengthen your immune system. And vitamin D is one of those micronutrients. So we know sunshine is good, and certainly of the last couple of days we've had some really good sunshine as well. But we also know that for sickle cell patients, the recommendation is by the Department of Health that you have your daily 10 microgram vitamin D supplement. But you can also have fatty fish, eggs, butter, etc. as examples in your diet. So selenium and zinc, those are also other nutrients that we know can be deficient in sickle cell, but that we know that can enhance and that can support immune function. So making sure that you're getting in these examples of foods, and we spent a lot of time and examples of this in session 3 as well. So making sure that you're getting in these foods in your diet. So chronic inflammation, again, and this in the context of sickle cell, and also in the context of oxidative stress. And I said that oxidative stress is that imbalance of harmful substances within the cells that can cause tissue cell damage. And this is common in the context of the chronic hemolysis, this ongoing breakdown of your red blood cells. And this, as I said, can lead to tissue damage, can lead to cell damage. And also, to counter the effects of this oxidative stress, you will need to increase your intake of antioxidant foods. And again, that's one of the messages that's within the Eat Well guide. So what are oxidant-rich foods? Vitamin A, vitamin C, vitamin E. And that's why your 5 a day is important. When I asked the question in session 1, I think people were saying that they have a 1 a day or a 1 a week or 2 a day. So by now, for those of you who've been on the call, you should be up to your 5 a day. put in the chat, what are you on at the moment, okay? And I'll check afterwards. So thinking about anti-inflammatory foods as well, omega-3s we know, and we know that that can be deficient in sickle cell patients living with sickle cell disorder. So examples of that, your oily fish, salmon, mackerel, sardines, and also your plant examples, walnuts, walnut oil, flaxseed oil, chia seeds, canola oil. So including anti-inflammatory foods, turmeric. We also looked at some other examples as well in session 3. So you may want to, once the recordings are available, have a look at that as well. If you are taking supplements, then please just check with your healthcare professional before doing so. So this slide I wanted to share with you because there's some very helpful information in the slide that in the context of how nutrition contributes to normal immune function. We know in sickle it's not normal, but we want to enhance how well your immune system can function. But the immune system needs a lot of energy. We've spoken about malnutrition and you're needing extra energy. So even to get your immune system to work well and normally, a lot of energy is required. And where do we get this energy from? We get this energy from your body stores. Yeah. We also get it from your diet. So if you are already at risk of malnutrition and you have an increased risk of infection, can you see how that even further increases your need for more energy? So the immune cells are very active. They have high energy requirements. And if you're recovering from infection during that period, you will still require high nutrient intake, high energy, high protein. So beware, all right? That you may need to take in a little bit more. You may need to do more of that food fortification that I've referred to earlier on. So when you're looking at the immunity, again, looking at the microbiome or the gut and the colonization of the gut, that's all about blocking some of those pathogens or the harmful bacteria that can cause infections within the gut. And some of the factors that can affect your microbiome or pardon me, I've just drank some water, or the bacteria that's in your gut. It's the environment that you live in. It's whether you have pets, um, antibiotics. So many of you will have had antibiotics, because of infections that can disrupt the balance of your good and healthy bacteria. Introduction to foods, the birth route. So when babies are born, that can introduce different sort of bacteria within the microbiome of babies as well. And then what are some of the building blocks, the specific building blocks that can help to build your immune system? And again, you will recognize some of the things we've already spoken about. So fatty acids, your omega-3 fatty acids, vitamins and minerals such as vitamin A, which is an antioxidant, zinc, we know is important in terms of immunity, amino acids such as arginine, and then functional foods like probiotics and prebiotics. And I've included a slide to talk you through a little bit more about what probiotics are and what prebiotics are. Hopefully this slide was helpful for you. We're stuck again. So what are the benefits of gut bacteria? Why do we need to have gut bacteria or beneficial gut bacteria? So it helps to protect the gastrointestinal tract, the GI tract, from harmful bacteria and fungi, and also helps to aid the immune system and how well the immune system can support your body. And there is something called symbiotics. So this is where you have both beneficial bacteria as well as prebiotic sources of fiber that becomes the food for your good bacteria or the probiotics. And as I said, there's a slide to explain that a little bit more. And examples of this symbiotic food is cheese, kefir, and sauerkraut. And it's all about balancing the good and the bad bacteria, to ensure that, you still have a really good functioning immune system. So that means you need to be eating plenty of both probiotic foods as well as prebiotic foods. So what are probiotic foods? They are the beneficial bacteria that we need to take in to ensure that we have a really healthy microbiome, as I mentioned earlier. And this includes live bacteria that can be found in certain foods. The best strains include Lactobacillus acidophilus. I don't know if I've said that correct. But yeah, so that is identified as one of the best strains that you can include. It provides numerous health benefits, and some examples of probiotic foods include yogurt. So in choosing a high quality plain yogurt with live cultures, fermented foods, sauerkraut, kimchi, kombucha, tea, kefir, and also some pickles and pickled vegetables. So these are just examples of some of the foods. Some of you may already be having some of this. If not, you may want to try that. I've recently tried the sauerkraut, and I found it actually really enjoyable to have. I wasn't sure about it, but you can try some of these to ensure that you're getting in and introducing these beneficial bacteria into your microbiome. So when we're looking at prebiotics, and what are prebiotics? They are actually the food for the beneficial bacteria that I've just mentioned in the previous slide, and can come from certain types of carbohydrates, mostly fiber that humans can't digest. So the fiber that we're taking through the diet, so some of the skins, some of the pips and seeds that will pass through the body undigested, that can potentially become the food that the helpful and the beneficial bacteria feed on. So there's a couple of slides that I will talk through earlier on that gives you a little bit more information about fiber when we come to talk about constipation. But what are some of the prebiotic foods that you can already be thinking about introducing into your diet? So examples are Jerusalem artichokes, leeks. I use leeks quite a lot. Onions, and I would imagine that you use onions a lot. Asparagus. It's not my favorite, but this is an example. Fruits, for example, bananas, berries, legumes, beans, peas, oats. So a lot of foods that you may already be including in your diet. And this potentially becomes the food for the beneficial bacteria or the probiotics that I've spoken about. Good. So hopefully that covers the information around the chronic, the impaired immunity, as well as the chronic inflammation, and how and what you can do to boost and to build a strong immune system. Sorry, my throat's dry. So now we're moving on to opioids and constipation. And you might think, how does this go together? It goes together because constipation in the context of sickle cell disorder comes because it's a side effect of the opioid pain analgesia that you take to manage your sickle cell crisis pain. So what does the pain medication do? It affects the nerve endings of the bowel, and it makes the bowel more sluggish. It means that the food moves slower through the digestive tract, and this can enhance the effects of constipation. Yeah. So how do we manage constipation? And I like to advise on the 3 F's. So increasing your fiber intake, increasing your fluid intake, and increasing fun activities. So in terms of fiber, and there's a couple of more slides that will give you more examples of that. So examples are whole grains, brown rice, brown pasta, nuts, seeds, fruit and veg. Remember your 5 a day. So your fluid, again, thinking about the Eat Well guide, the recommendation there's 8 to 10 cups. In this hot weather, that will increase. So you may have to take 10 or more, up to 3 liters of fluid, and that can be water, herbal teas, fruit, squash. And fun activity, the recommendation is at least 50 minutes of activity. Can be cleaning your house, Who enjoys doing that? Walking, yoga, Pilates, swimming. So these are examples of what you can do. So again, this image is just to show you some of the examples. It can be water is obviously the best option. If you can drink the water, that's fantastic. Many people are not able, they really struggle to get in water. So it may be that you're taking it in through a juice. It may be that you enjoy a good cup of tea like myself, some smoothies, so some squash. So just, find ways that you can ensure that you drink up to the 3 liters a day. And as I said, that number will differ depending on if you're unwell, if you have a temperature that can increase your fluid intake. And if it's warm outside, that can increase your fluid intake. But for some people who have kidney problems, they may need to adjust their fluid intake. So it's just sort of knowing, what relates to you at that particular time. But on average, definitely aiming for 3 liters. So in terms of your fiber, aiming for 30 grams of fiber a day. And I've got a slide to show how you can do that. So again, a range, choosing your whole grain, your oats, pasta, whole grain pasta, etc., as your better examples. So just in terms of fiber, a little bit more information in terms of thinking about the constipation. So fiber is the broom of the colon. It helps to sweep and keep the colon really healthy. So the muscles are exercised and kept healthy by taking in enough fiber. It reduces your risk also for other conditions like diverticular disease as well as cancers. Wheat bran is a good example of a stool softener. Softener if you are really, I'm so sorry. My my pronunciation is going. If you are struggling with constipation, then trying wheat bran in your diet and also isfagala husk as an example that can help to soften the stool and that can help to better manage your constipation. But also ensuring that you're taking in different types of fiber, in particular soluble fiber. And we spoke about this in session 1. So examples are pectins, guar gum, oats, beans, apples. And what this fiber does, it forms gel in the presence of water. And this actually helps to soften the stool, making it able to move through the bowel a lot easier and more regular. So you want to ensure that you're getting in these foods soluble fiber to help that. Soluble fiber can also help to reduce cholesterol levels, and we've got a slide later on about cholesterol. And then the insoluble fiber, it adds bulk to the stool and helps to stimulate the bowel movement and in that way prevent constipation. And remember, insoluble fiber, that is also an example of prebiotics, which is the food for your beneficial bacteria. So examples of fiber swaps that you can consider: if you have cornflakes in your diet, maybe consider oats or maybe bran flakes or Weetabix. If you're having white rice in your diet, aim for brown rice. It's really nutty. I really enjoy brown rice. If you're having biscuits as a snack, go for unsalted nuts, go for fruit as an example to get in that extra fiber. If you're having white chapati or roti, try a wholemeal chapati, a wholemeal roti instead. And these are just simple fiber swaps that can help to increase your fiber intake. So I mentioned about this slide of just giving you an example of how you can actually increase and achieve this 30-gram fiber intake in your diet. And so it's quite small. Hopefully you can see though. For breakfast, as an example, if you're having raw porridge oats, if you're having, in addition to that, you're having frozen raspberries, you're having plain yogurt and milk, and you're having like a nut sprinkle on top. By just having that, you can in total get 4 grams of protein from the oats, 1.3 grams of protein from the frozen raspberries, and you can get up to 4 grams of not protein, fiber from just having that sprinkle of walnuts and almonds. So there, just for breakfast, you already have over 9 grams of fiber in your diet. So for lunchtime, example, having a baked potato, baked beans with some sweet corn, You can, from the baked potato, you can get 5 grams of fiber. The baked beans will give you 3 grams of fiber. The sweet corn, 2 grams of fiber. And there for lunch, you've already got 10 grams of fiber. And then the example for the evening is wholemeal spaghetti with pesto, broccoli, cherry tomatoes. Again, you can see with just those two combinations, a total of 8 grams of fiber. And certainly if you're using snacks such as wholemeal bread and having a piece of fruit, that can also add. So it is possible to achieve the 30 grams of fiber intake in your diet. It just means that you have to be thinking, and remember the planning. We said planning. So part of the planning, making sure what do I include in my diet to ensure that I get in that amount of fiber that's going to help prevent, but also better manage constipation if that is something that you're struggling with at the moment. So the F is physical activity, aiming for 150 minutes. And these are just examples of what you can do. So the combination of it, drinking enough fluid, taking enough fiber, and fun activity is key in terms of uh, uh, reducing and preventing constipation. I'm going to speed up because we've got a couple more slides to go through. Iron overloading, as I've mentioned before, if you do suffer from iron overloading, you have to reduce the amount of iron in your diet, but you also have to be compliant with your iron chelation regime, really important. So what can you include in your diet? Fruits and vegetables, grains, legumes, eggs, lean protein sources, chicken and turkey, or if you're having tofu, if you're vegetarian, vegan, obviously having your examples there. But tea and coffee can help to reduce iron absorption. So if you are struggling with iron overloading, so have a tea and coffee with your meals, and that will block the absorption. And also reduce your intake of vitamin A and vitamin C rich foods, because that will enhance, as I said, iron absorption. Reduce the intake of iron fortified foods. So read your labels, very importantly, and also avoid supplements that contain iron. So that's iron overloading. So if we're thinking about osteoporosis, many of you may not even think that you have an increased risk of osteoporosis, but you do if you're living with sickle cell disorder. So bone, just to give you some background, is a living, growing tissue, and it changes over your lifespan and throughout your lifespan. And essentially what osteoporosis is the loss of bone density or mass, and ends up with your body containing abnormal tissue structure. And I've got an image to show you what that looks like. So an image of normal bone is sort of honeycomb with holes and spaces, but these spaces become so much larger when you have osteoporosis, because and leaving the bones becoming less dense, they become weaker and likely to break. So I just want to show you what that looks like. And this is what it looks like. So as you can see, the spaces there are so much bigger, and so your bones become thinner, they're more brittle, and they can break a lot easier. So what are the risk factors that you need to be aware of, in terms of osteoporosis? So if you have a low weight, that is a very important clue for an increased risk of osteoporosis. If you have low vitamin D levels, that increases your risk of osteoporosis. Hemolysis, and you know what hemolysis is the ongoing breakdown, the rapid breakdown of your red blood cells. Inflammation, and we know inflammation is common in sickle cell disorder. And if you have something called hypogonadism, all of these things cumulatively can increase your risk for osteoporosis. So if you have any of those, I would say speak to your healthcare professional, speak to your consultant to ensure and to have the test to assess, your risk for osteoporosis. So what about your diet? So what do you need to include in your diet to reduce your risk of osteoporosis? I've mentioned this before, but vitamin D. Vitamin D, include your vitamin D intake. And what's important about vitamin D, it helps to regulate calcium absorption in the blood and also regulates the level of calcium and phosphorus in the blood. So vitamin D is important. So please, 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 if you're not taking your 10 micrograms of vitamin D supplement a day as recommended by the Department of Health, then I would highly recommend that you do so. So thinking about calcium and calcium-rich foods, dairy products, we know is the main source. But also if you don't take dairy, ensuring that your calcium or your dairy alternatives are fortified with calcium. Please make sure, read your label to check that it's fortified with calcium. But other foods that can increase and provide calcium, Brazil nuts, tofu, green leafy veg, sardines with bones, whole grain foods as well. So for phosphorus, again, dairy foods, red meat, poultry, seafood, legumes, and nuts are good examples. And again, ensuring that you have and maintain a regular activity, very important. So what are benefits of physical activity? Because I mentioned about physical activity when we spoke about chronic anemia and fatigue earlier on, or anemia, but also now we're speaking about benefits of physical activity in the context of osteoporosis. So what are the benefits? It's important in terms of maintaining a healthy weight, so weight maintenance. It's important in terms of improving your balance and strengthening your bones, particularly if you have an increased risk of osteoporosis. It can improve your bone and your heart health. It can improve glucose tolerance, but importantly, it can also reduce your anxiety and stress. So if you're thinking about what can I do in terms of relaxation, we spoke about that in terms of self-care earlier on, do some physical activity, go for a walk, start a group, and and gain the benefits from physical activity. As you can see there, do it as a family. I love this image. Do it as a family. So the next one we'll move on then is cardiovascular risk, because again, living with sickle cell can increase your cardiovascular risk, can also increase your risk of higher cholesterol levels. So what can you do to reduce your cholesterol levels? This was the question that was asked by someone in session 2, and I said we will talk about it today. So there's a couple of things that you can do to try and lower your cholesterol level. And one of the first things that I would recommend is to reduce your intake of saturated fatty acids. So why saturated and what are saturated fatty acids? So saturated fatty acids are fats that you predominantly get from animal products, so your red meat. So what you want to do is you want to reduce your intake of your foods that contain your red meat, but also you want to reduce your intake of processed foods and snacks. Reduce your intake of dairy products, sausages, pies, pastries, cakes, etc. All of these foods contain saturated fat that will naturally increase your blood cholesterol levels. So to counter that, you need to reduce your intake. So what do you do instead? You increase your intake. You eat more of your unsaturated and polyunsaturated fatty acids. And omega-3 is an example of a polyunsaturated fatty acid. And that we know, we've spoken about that in all the sessions, is to help reduce the chronic inflammation as well, but certainly that will help as well to lower the cholesterol levels. And there's examples of the types of foods that you can take in to ensure that you get a good amount of omega-3 fatty acids. The other thing that's important in terms of lowering cholesterol is increase your fiber intake. And we've had several slides now to give you really good examples of fiber. And so not only is fiber important as food for your good beneficial bacteria, not only is fiber important for reducing and managing your your constipation, it's also important to lower your risk of your levels of cholesterol. So fiber foods, particularly oats. Oats, we know through research, has also been shown to reduce the cholesterol levels. So other foods like beans, whole grains, nuts, and seeds is important. Achieving and maintaining a healthy weight will go a long way to also reduce your cholesterol level. So if at the moment you are a higher weight than health, what a healthy weight should be, then definitely look at what you need to do to try and achieve a healthy weight. And that process will help to reduce the cholesterol level. Stop smoking. We started off speaking about reducing and stopping smoking. Stop smoking will definitely go a long way to reduce your cholesterol level, and also reducing your alcohol intake, keeping it within the healthy normal limits will certainly help to reduce the cholesterol level as well. And there's another compound called plant stanols and sterols. You may not have heard of this before, but these compounds have been shown through research to actually reduce the cholesterol level. And have you heard of a food a range called Benecol or Flora Proactive? So these food ranges, they actually contain these plant stanols and sterols, and they if you take this in your diet or include that in your diet, then that can also help to reduce the cholesterol level. Just to say that some patients can have familial or family uh, uh, um, a risk for high cholesterol levels. So if you are one of those people, then again, it's even more important that you take into consideration and apply these practical tips that I've spoken through to try and keep your cholesterol levels to as low as possible. Having high cholesterol levels increases your cardiovascular risk, your risk of heart disease, your risk of stroke. And so, you want to pay attention and definitely do all that you can to reduce your risk. So this is just an example of some of the healthy fats that you can include: olive oil, avocado, nuts, and seeds. So again, we looked at some of these examples of healthy African meals. So this is what your meal should look like if you're eating a traditional diet. So lots of greens, smaller portion of your carbohydrates, but a good amount of protein, having more salads as well. This is how helpful in terms of reducing your cholesterol and your cardiovascular risk. And also Caribbean meals, there again, having lots of greens on your plate, and having lots of vegetables on your plate as well. So all of this can also help to reduce your overall cardiovascular risk. So the last session, last part of this is looking at mental health and diet, because again, we know that mental health is a problem in the context of sickle cell disorder, but we don't always look at this in the context of diet and what are the nutrients that we need to include in our diet to help keep our brains healthy and also help us to have a really good mental health. So we know that mental health in the context of sickle cell is a long-term condition. It's a marginalized long-term condition. There's multiple complications. People can have lots of disabilities associated with those complications. They can have their health outcomes, negative health outcomes, but also there can be other factors that can influence the mental health and in sickle cell patients. So what are some of those contextual factors? And I spoke about this in session 3 as well. So, and this was identified through my research: personal, internal, and external factors. And part of those internal factors that were identified are psychological, emotional attitudes and beliefs that can influence, patients' choices of food. And it's important that we recognize that these factors not only impact on your mental health, but also can impact on your nutritional health. And that's why I highlighted this again in this slide. So what are some of the sickle cell related mental health problems that you may experience? High levels of stress. We know that because it's in the research in the context of sickle cell. Patients can experience high levels of anxiety living with this long-term condition, high levels of depression, low mood, fatigue, and actually, we can find evidence of depression within the children as well, because living with the impact and the effects of sickle cell disorder. So when we're thinking about nutrition and mental health in sickle cell, what I want to highlight with this slide is that what we eat and drink can also impact on our mental health. It can impact on how we think, what we feel, and also how we behave. So that's important for you to consider. And the word diet, when I use the word diet, many people have a negative connotation to the word diet. So what I'd like you to take away from this slide is the Latin definition of the word diet. And that word is dieta. And that refers to a way of life. So when you next time hear the word diet, I want you to be thinking about it, not as what I can't have, but as a way of life. And then reframing your way of life through the context of you building a foundation for long-term health, as well as physical, emotional, and mental well-being. So as I said, when we're thinking about mental health, our brain, we can't neglect the health of our brain. And so there's important nutrients that we need to have in our diet to ensure that our brains can work and function and stay as healthy as possible. And those key nutrients that have been identified are complex carbohydrates, essential fatty acids, amino acids, vitamins and minerals, as well as water. And the next slide just gives us more examples of that complex carbohydrates. We've spoken about it so much throughout the course, but also this evening in terms of whole grains, in terms of brown rice, pasta, healthy fats in terms of omega-3, proteins, amino acids in terms of legumes, lentils, milk products, lean meat, ensuring that we take in that 5 a day, that mix of vitamins, fruits and vegetables, but also ensuring that we get in that 8 to 10 cups of fluid, but we know that we need more depending on sort of certain, if it's hot or if you've got an infection, etc. So what are some of the risk factors, that can affect your mental health and also how your brain works? Your blood sugar levels, if you're living with diabetes as well as sickle cell, if you have low blood sugar levels, that can affect your brain function. If you have dehydration, that can lead to headaches, but also can affect your concentration levels and how your brain functions. If you're taking in caffeine, that can enhance the effects of dehydration. Alcohol can enhance the effects of dehydration, and in terms of sickle cell crisis, but also in terms of headaches and in terms of how your brain functions. Certain medications can have food interactions as well, but also there's this gut-brain interaction where stress and anxiety and certain food choices and appetite can also impact on how well the brain works. So it's important that you're aware of these risk factors in terms of mental health, but also in terms of brain health. So what are some of the helpful tips? Plan ahead. You see, planning comes in here as well. Asking for help, educating yourself, just like you're doing now in terms of this course. Have reminders. Have you drunk enough water? Have reminders. Take daily action. And again, as I mentioned earlier, reframing your health through a lens of long-term health and well-being. This is for the rest of your life, which means you need to be doing it every day. So that's the end of part 3, and I'm going to go on to part 4. Hopefully you've got some really helpful practical tips and strategies to navigate some of those common nutritional problems you experience with sickle cell, but to then bring this, session 4 to a close, I want to just highlight some of these important points as a summary of today's session as well. Look after your mental health. Take care of your heart health. Engage in regular movement to keep your bones healthy and strong. Pay attention to your nutritional health. Know your risks. Ask for help. Understand your sickle cell, how it affects your overall health and also your nutritional health. Be proactive and take daily action to build a foundation for your long-term health and well-being. Be willing to change unhelpful habits. Stop smoking. And then the very last slide. This I shared with you last time, but I shared this recently when I did a transition session with young 12 to 14-year-olds, and I felt I wanted to end off our nutrition course with these 4 questions that I want to put to you. Factors influencing your quality of life. So in the context of your goals, expectations, standards, and concerns. And this is actually, as I mentioned in session 4, part of the definition by the World Health Organization about quality of life. And it says we need to have and consider these 4 influencing factors. So my question to you is in terms of your goals. Have you set goals for your health and well-being? And if you haven't, my challenge to you is to start doing that today. What are your expectations? What are your hopes? And what is influencing your expectations? If you don't have expectations, if you don't have hopes, I want to challenge you today to think and consider about adopting healthy expectations about your health, about your nutrition, about your health and well-being, about your quality of life. What about standards? What about principles? You spoke a lot about healthy eating principles and so much more. But what standards have you set for yourself? And again, if you haven't set any standards for yourself, I want to challenge you and encourage you to start doing that from today. And what about your concerns and your worries? How do you manage that? Are you holding it to yourself or are you sharing it? Remember, ask for help. So I want to challenge you to think about how are you managing your concerns. And then finally, don't forget to download the Eat Well guide and complete the survey if you don't mind doing that, and look at the other resources on the Sickle Cell Nutrition Academy website, the Nutrition Compendium. And one thing that you will take away from today, put it in the chat. Put it in the chat. One thing that you want to take away from today. And I will read afterwards. So thank you. So this concludes our 4 online sessions around managing nutrition in sickle cell. And I want to leave you in black with this quote that I specifically chose for each one of you on the call today. And as I said, those of you who have been very loyal and been attending over the last 4 sessions, it's never too late to be what you might have been. So take on board all of the advice, suggestions, guidance that you've got from today and over the last 4 sessions, and decide today to choose differently, to choose your health and your well-being. Thank you so much. And I'll stop sharing.